Hello, good morning. Thank you for coming. It is Sunday morning, so you rather be with your family, but I appreciate that you are here, but I will tell you that you will not disappointed. It's something completely new you will learn today. We are in great danger in Western medicine because of 6 reasons. First of all, we have forgotten that we are very much in our own doctors ourselves. Secondly, we have the biggest industry right now because the pharmaceutical and insurance company became so rich, and they are very constantly making a new medicine, and we are all addicted to new medicines and side effect, lot of side effect. And then thirdly, most of them does not know have time to spend with a patient because they're constantly new findings and new papers they have to study, and then to keep your own licenses. And then our medical practice has gotten into such details, the whole body as a whole. We don't think like that. I just had an accident. We had a big accident, 3 spine broken, I did, and then this brachiopraxis. I had to go to 5 different doctors because one is a shoulder expert, one is an arm expert, one is a hand expert, and one is, of course, spine expert, and one is a nerve expert. All these things. So we want to reconsider meaning of the healing again. We have to reconsider this. And then I have taken study of Hippocrates. 2 of the 600 Hippocrates quotations, I'm studying these 2 of them. And you will see how I apply these 2 later. Do you mind if I go up? Thank you. Well, these are all one of the Hippocrates, 600 Hippocrates. Now, we have invented far infrared and terahertz vibrations with the heat. How many of you know the word terahertz? Can you raise a hand? Okay, no, nobody knows. But from now on, 10 years, you say you heard it for the first time here. Okay? I hope so. Now, terahertz. Wait a minute. Excuse me, I am 80 years old and I am very bad with this kind of things. Okay, far infrared. How many of you know far infrared? Or infrared, let's say. Some of them heard infrared. But far infrared is part of infrared. It's quite different. These are 2 separate vibrations. One is coming from the sun, far infrared vibrations. The other is coming from the deepest source of Earth. Japanese scientist has recovered some of the most important stones vibrations from the Aso volcano. It's active and it comes out every day. And these stones are considered to be very healing, and everybody, 5,000 years, Japanese used it for pain, other things. But we have been now using it for hoping to capture this vibration of terahertz together with Earth once, and what we are discovering as is hand healers, healing energies, and all this hand and all other important healing energy from human being. Jesus Christ, Buddha, everybody did it, but we don't know what it is. But now we can find out. No disease is incurable, as I said, and Hippocrates said that too. But it's a self-healing that we have to cultivate self-healing. It is to do with very much mind-heart. Mind-heart. And then we have to meditate every day so that you get this inspiration from the sun and inspiration from the earth. What is onnetsu? This is a method of onnet therapy. It is hypothermia because we use the heat. But acupuncture, we use the knowledge of acupuncture. But moxa bastion without smoke or smell. So, onnetsu meaning comfortable heat, dealing with self-healing power, new totally natural way. And we are using NASA's technology and terahertz technology, and then Japanese traditional heat therapy. Also balances autonomic nervous system so that you can raise your immune system. And then also, fourthly, we use acupuncture technique of flow of the body. We help the flow of the body. This method of onnetsu is now becoming a very, very, very effective method. So I have personally did all this more than this, but anyhow, this is because it works on anything. This is because onnetsu works on your own healing power. You restore your own healing power. Many, many more. We have a recent study in Cuba. We have gotten 40 stage 4 cancer, and we did this onnetsu method for 30 days. Every one of them got cancer voided, and it is in hospital studies. So, but the thing is, the doctors, 40 of them, out of 40, 38 recovered complete health. But 2 of them died before even we started. So this was this serious kind of people. This was Dr. Jose Certucha. And the Dr. Certucha forgot to take pictures at the first week because he didn't think this was this effective. So, but this is on the right-hand side, left-hand side is a picture of the second week. And the last one is the third week. And then fourth week, he healed himself. So, onnetsu therapy has 3 very important aspects. One is finding where the problem of the cells are. Second is to heal with the heat. And the third one is making a balance on autonomic nervous system so that this completely enhance healing power. And the fourth one, as I said, is to do with acupuncture, to do using acupuncture technique. And this is advanced technique. So first one, I'm going to use 4 very quickly. First one is sunlight of vibration, precise 8 to 10 microns, and far infrared, and then terahertz vibration. From minerals from deep inside, comes out every time it erupts. Socrates said this. But anyhow, as early as 17th century, Japanese was saying this. It's very important to have sunlight. So NASA's finding in the 1960s, NASA said, this is the range of infrared. Far infrared is part of infrared, but it helps a lot of healing and rejuvenating. Now this is a very, very small range of, I want to point it out. 8 to 14 microns, 8 to 10 microns I'm using. Infrared, everybody knows, is 0.75 to 1,000 micron wavelengths. Okay. Now, this is an interesting, I don't know, where does this move? Yeah, he's putting one ice on a regular plate, and the other one is a black plate, which is far infrared and terahertz. Watch the ice. One is staying there. The other one start moving. You see moving and dancing? That is what it does, far infrared does. It melts, it goes deep. And none of this plate has any electricity. It's just a plate. This is the difference between regular ceramic and the far infrared and the terahertz ceramic. Since we don't have much time, we're going to go on. Do you understand this? It's dancing around, vibrations, without any electricity, nothing. So this is the difference between terahertz and the far infrared that I am using is exactly the same spot. And infrared, far infrared I'm using, NASA's far infrared is 5 to 25 microns. Mine is 8 to 10 microns only. Oh. Mine is 8 to 10 microns only. And then this goes into the deep inside of the skin, and then it reaches the water molecules level. And then it starts vibrating. Now this is a very interesting, there is a skin, and my machine is above the skin, like this kind of thing, sliding onto the skin. Oh. And then when it comes to the negative, unhealthy cells underneath, about 25 centimeters down, the patient says, ouch. Patient says, ouch. Okay? That's important. So we know where is the location of the cancer or any other negative disease. This is my, actually I had a pancreatic cancer, and then all the cancer markers like integrins and all that things were very, very high, and then after 10 minutes, 15 minutes, everything went down, become very, very healthy. This is an actual clinic of Dr. Shimotsura. And I am fine and healthy. Oop. So how is it made? We make this with about 16 minerals and bake together and become a ceramic. And once you become a ceramic, including terahertz, once you become a ceramic, we crush the ceramic and we create a sheet of look like a cotton. We create ceramic like this. So we are using this in many of the pain-killing things. These are the cottons which has no electricity. Now, next is the heat. This is a famous Hippocrates. Hippocrates said that you can do surgery and you can do medicines, but ultimately it is only heat which heals. This is a Japanese person who did say that. So, anyhow, I'm going to skip this, okay, about the heat. You know very well, you have to have a temperature, inner body temperature. If it goes down than 35 degrees, it becomes trouble. Because it becomes very high cancer cells, increases and everything. So 35 degrees is a minimum inner body temperature. Now, there was a big study in Rochester for the first time. After 20 years, I've been talking about heat, heat, heat. They did this I'm going to skip, but they say that cancer cells are very cold. And they did it with a mouse, and then they made this chamber 20 to 28. These 5 temperature, and then half of the mouse which is affected with cancer running into the highest 38 degrees. And the Japanese concept of heat, it is terribly important. And we have, like here, we have a very big thermal water. And thermal water has this terahertz and the heat. So it's incredibly healing. Now, ouch reaction I talked to you about, ouch. Patients say, ouch. And then that's where the treatment point is. It's so simple, isn't it? When you find ouch reaction spot, you go back and back and back and heat it up with this. Well, this is technical, but if it's a cancer cells, ouch reaction lasts longer than normal. If it's a normal, like a rheumatoid arthritis or any liver disease or anything, lung diseases, when I take it off, it stops the ouch. But cancer cells lingers longer, so I can identify the cancer almost. Okay? We don't have to go through this terrible test and test and test. It's a very primitive looking way of finding, but it is very sure. Mock Sebastian this is a traditional, same concept. And I did heal 11 children in Himalayas with tuberculosis. I used this point, they were all hit. Now those are the 11 my children in Himalaya, in orphanage. Okay. So, cause of low temperature. Why do you get low temperature? You're drinking soda all the time. So we go into that balance. It is very important to balance through autonomic nervous system. Now, Hippocrates said when it's sickness, you look into the spine. So we use the spine, and we find the hot spot in spine, which is not only that is a hot spot, but related to that organs which is related. You know all which vertebrae is related to which organs. And this we use as a diagnostic technique. And this we same thing, diagnostic technique with a spine. Now we balance the autonomic nervous system with parasympathetic and sympathetic dominance. This is a very important part because, we call it workaholic personality. Bam, 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 you're working all the time. That's sympathetic. But parasympathetic is called couch potato. They are sitting in a couch, and it's very, very nicely, very lazy. So any other way, method of autonomic nervous system balancing is very difficult. You can do meditations and all that things, yoga, but it's very difficult to accomplish. So Dr. Torabo, the famous immunologist who was slated to become a Nobel Prize winner, became, became known as my teacher. He became known as how to balance the within white cells. And then he said it's in red. Granulocyte should be 60%, and lymphocyte should be 35%. And if that is not accomplished, it's not easy to balance. But I discovered even above ideal ratio exists. If you don't have the heat, you cannot balance so easily. So I talked about this, and after that he talked his books, about 30 books on heat. Now this is my patient who had a full of cancer, started everywhere, brain and everywhere, and she came to be treated by me, and then I said to her, why, think about the death, because she obviously was going to die in 1 or 2 days, and the hospital had given up. And then so she mentioned that she doesn't want to die, she wants to live. She is so eager to live. So I told her, this is your problem. It is anxiousness, stress, wanting not to die. In Buddhism, dying is taking a dirty clothes off. That's all. And the spirit will live again. But anyhow, she went home. I told her to go home to think about dying. And she came back and she said, I accept my dying, so please try. And the first time I did it, she was here. Oh, it doesn't work. 86% on the lymphocyte and granulocyte, and the lymphocyte was only 72%. Now at the end, 3 weeks later, her ratio was almost perfect. 61 and 31 and 7.3. So when this became accomplished, she became very, very quickly recovered. She was completely full of hundreds of cancers, and I had to tell her, you have to stop what you're doing. Don't go back to your work, which was day trading. Do you know what a day trading is? It's in Wall Street. You trade every minute. Okay, so that's what happened to her. and that she was totally stressed person.
Dr.
And that's the place.
Please,
Yes,
could
thank
you summarize?
These are diagnostic places of places. Now, this is the spine. I love spine, so even I broke 3 recently. So anyhow, I have my card and my 1-page, 2-page things, and then my brochure on the second chair on the first row. And I have to realize that we are already in an age that we have to cure ourselves. And force, I cannot call in a force, but if you have any business card, please leave it business card, okay? This is my 4th point with anyhow. And we balance yin and yang organs. We work with a relationship. Mother has to help a child. So if you have a lung problem, you have to watch for large intestine, and you will find a hot spot in large intestine. This is the most remarkable thing. So you work not only lung hot spot, but you work with large intestine hot spot, and in channels and meridians. This I am going to skip now. So anybody who is interested in this kind of method, I am looking for doctors with a affiliation of hospital. Like in Cuba, they had a 40 stage 4 cancer, but I will accept 9, and I would like to support with these machines and that come there to teach, so that number of doctors and the nurses can administer this point. And I am very happy. Turkey has a tradition of women making hospitals, orphanage, and I hope this continues. Thank you so much. I will have to stop to ask the questions, to answer the questions.
Thank you very much for this. Thank you very much.
Oh, I forgot.